Alhamdulillah, wassalatu wassalamu ala rasulillah. Assalamu alaikum everyone. Welcome again back to our Save One, Save Humanity Class 2. Really glad that everybody's back again. This is a continuation of our last class of basic life support. I'm Nabil Abdurrahim, one of the emergency doctors. Along with me are my friends, Dr. Zishan, Dr. Nurdin, and Dr. Vikas. A quick reminder again for the whole reason that we started this course. We started to be known as lifesavers. And I hope many of you would have seen that we're using this term as lifesavers, even in the groups and messages. And the essence of this comes from the ayah from Surah Al-Ma'idah. أعوذ بالله من الشيطان الرجيم. ومن أحياها فكأنما أحيا الناس جميعا. And whoever saves one life, it is as if he had saved mankind entirely. And this is the core basic reason that we started this course, to make you all as lifesavers. So moving forward, we saw that there are three parts of our course: BLS, basic life support; BTLS, basic trauma life support; and environmental emergencies and poisoning. So we are in a second class of basic life support. So overview of today's class is going to be a recap from last class, what we did last class, a quick demonstration. Then we're going to check and show you how to do a CPR on a child and a baby. Then we will go to choking in adults, child and baby. Finally, we'll have a Q&A session, inshallah. So, reminding you of what happened last week, we can see that when a person collapses, faints, we asked you to remember a mnemonic called Doctors ABCD, DRS ABCD. It's the same thing that you need to follow for all the cases, including child, baby, everyone, but with small changes, which we will tell you today, inshallah. First thing is to see if there's any danger, check for response, tap on the patient and see, is the patient awake, is he responding? And then call for help. After that, you do neck extension, as you can see here, that the patient's airway is opened by tilting his head, lifting his chin. And then you give a compression to the chest, 30 compressions and 2 breaths, 30 compressions and 2 breaths. This goes at a rate of 100 to 120 compressions per minute, or roughly 30 compressions every 15 to 18 seconds. The motto is push hard, push fast, push hard. Also, given the situation that we are in today, with COVID all around us, the new recommendations from the Resuscitation Council are that if you are performing a CPR on a person who you suspect, have a strong suspicion that he or she has a COVID, then the only change that happens to the chest compression is that you put a piece of cloth on the person's face just to cover the nose and mouth. Everything else remains the same. You yourself wear a mask and you put a piece of cloth on the person's mouth, or to cover the mouth and nose, which we will be showing now soon, with Vikas coming for a live demo. So can I ask Dr. Vikas and Dr. Nabil to come live for a demo to quickly recap and show what we did last week? Okay. I hope everybody can see. Wa alaikum assalam wa rahmatullah.
So let's begin the demo.
Yeah. So you're ready, Vikas?
Yeah, ready.
All right, perfect. So just going over DRS ABCD. So the first thing when you see a person when he's collapsed is to check for danger. Look around, see if there is any obvious dangers like fire, electricity, water, anything that can harm you. If there is no danger, then you approach the patient and go near and R response.
Hi, sir. Are you okay? What's your name? Hi, sir.
All right, great. So no, if there is no response, call for help.
Nabil, can you help me out? Call the ambulance and get an AED if possible.
Okay, call an ambulance, get an AED. You point to one person and tell that. Next, check for response. And after response, you go for ABCD. It's airway, breathing, circulation. So you notice how Vikas is tilting the head, lifting the chin, and he has kept his two fingers on the neck. Because if you can show on the other side of the neck.
Yeah.
Yeah, so he's keeping his two fingers on the neck to check if the person has a pulse. You do this for 5 seconds, but not more than 10 seconds. And if there is no pulse, then you start CPR immediately.
There's no pulse.
Okay.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19.
Perfect. And he gives 2 breaths. Perfect.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Thank you. Thank you, Vikas. You can stop. Yeah. Great. So Vikas continues. You see that he's continuing to do 30 compressions, 2 breaths, 30 compressions, 2 breaths. He keeps doing this for 2 minutes, and then he can check for a pulse again if the patient has a pulse. If not, he continues the same process, 30 compressions, 2 breaths, 30 compressions, 2 breaths, until help arrives. Or someone gets an AED machine, which can be attached to the chest. We will talk about AED soon, inshallah. But before that, I want to, make you, be firm on this first initial process, which is more important, that you continue chest compressions at all times. You do not stop and check anything. Continue chest compression. That is the most important thing for the patient. Okay, doctor, thank you very much. We'll come back to you soon. And once we finish our child slides. Thank you.
Okay, thank you. Thank you.
Fine. So going back to our slides. So let's say if you're giving chest compressions and the person gets a pulse back, okay, what do? The help has not arrived yet, ambulance has not arrived yet, but the person has got a pulse now. So what you do is, at that point, you turn the patient to the side, and that is called a recovery position. Like you can see in the image here, you turn the patient to the left side with the arm extended, flexed on one end, and you cross the right leg over the left. The reason we put the patient on the side is because we don't want him to choke on his airway, that he has his saliva or whatever it is in the mouth. We don't want that to be, or his tongue, we don't want that to obstruct his airway so that he won't be able to breathe properly. In this position, in the recovery position, the patient, if there's anything stuck in the mouth, that will fall out, okay? And the tongue will also not fall back. So this is important. When you see a person who's collapsed, at any time collapsed and does have a pulse, you should always put the patient or the person on the left side like this. Okay, so moving to our main topic today on child. What do you do when you see a child having a cardiac arrest? Or let's say a child who has collapsed and has no pulse. So the most important thing is starting again. Do not get distracted just because it's a child. I know there is an emotional element. All of us are emotional when we see children having something, undergoing like this. It is not something comfortable for us. But, have some wisdom and have a quick thinking. Go back to your DRS ABCD. All the steps are similar. Starting with danger, look for any danger. The child might have been electrocuted and there might be electric wires. You do not go jump in without seeing that and you get electrocuted yourself. So, these things have to be kept in mind. Next step is checking for response. It's the same process, tapping the shoulder. Then you shout for someone. Okay, ask them to get help. Then you check the airway, like how we mentioned in the adults, same thing, head till chin lift. And you check for pulse. If there is no pulse in the neck, then instead of going 2 hands, the only difference in the child is that you go with 1 hand. As you can see in the screen, it's 1 hand CPR. Okay, you just keep your 1 hand, the heel of the hand on the same lower 1/3 of the chest and keep compressing. 30 compressions, 2 breaths. 30 compressions, 2 breaths. Also, if you notice on the screen, I've put that if it's 1 person only, if you're the only person there, then you do 30 and 2 breaths. If there are 2 of you, 1 person can go get the help and ask for the ambulance and other things. And what they can do is come back and help you with the breathing. At that time, you give 15 compressions and the other person gives 2 breaths. You give 15 and 2 breaths. The reason a child needs 2 breaths, okay, after every 15 compression, we are giving more importance to the breaths here because usually in children, the main cause of collapse or cardiac arrest is not because of heart attack, like elder people. So the elderly population have heart attack issues because of a blocked artery in the heart or other age-related issues. But in a child, it's more of an airway issue. It's more of them not getting enough oxygenation to the lungs. So you give more oxygenation by giving 2 breaths, if there are 2 of you. Everything else is same, 30 compressions, 2 breaths, 30 compressions, 2 breaths. This goes on till the child has pulse. And once the child's got a pulse, we do the same thing. We put the child in the recovery position. Turn to the left side, flex the right leg over the left, and keep the airway open. That way, anything that the child has in the mouth will fall out. Now, coming to an infant, a child is anybody over 1 year old, 1 year all the way to puberty. An infant is someone who could be from just born to 12 months. So less than 1 year, 1 year and less is an infant. In an infant, it's the same approach, DRS, ABCD. The only thing, when you check for pulse, you do not check in the neck because babies don't have much of a neck to actually check your pulse. If you notice, many of you would have seen babies, you see they have very, very short neck. You cannot really feel a pulse. Their neck is so short. So in that case, you check your pulse in the arm. We will show you how to check soon. The other thing is that the CPR is done with 2 fingers on the chest. So 2 fingers instead of 1 hand. So 2 fingers on the chest. You press a depth of around 1/3 the chest, 4 centimeters, and keep doing that. Same, 30 compressions. Then you give 2 breaths. We will show you how to give breaths as well on a child. And then if it's 2 of you, 15, 2. If it's 1 of you, 32. Okay. So like I mentioned, where to check the pulse in a child? The pulse is checked in the inner part of the arm of a child, just above the elbow, inner side of the arm, like you can see in the picture here. What we are checking here is the brachial artery. So that is normally felt, even in thin individuals, in adults, if you press really hard in your arm, you can actually feel the pulse there. Okay. So in babies, definitely, because they have very soft muscle, you can easily feel the pulse in the inner part of the arm. Again, you check for 5 seconds, not more than 10 seconds. If you don't feel any pulse, or if you feel a very weak pulse, very weak, I mean, less than 6 pulses every 10 seconds, or let's say you feel only 2 pulses every 10 seconds. You have to check only 10 seconds. So I'm saying the first 10 seconds, you felt only 2, 3, 4, or 5, 6. If anything less than 6 pulses you feel, you still have to start CPR. In children, even if they have a heart rate of less than 60, they are considered to be still having a cardiac arrest. Okay, that blood pressure, that heart rate is not enough. In an adult, 60 is a normal heart rate. Okay, 60, 70 is a normal heart rate, almost a normal heart rate for an adult. For a baby, 60 is a very, very low heart rate. Their normal heart rates are around about 130, 140. So that's pulse check. Next thing is compression. So if it's 1 person, you use your 2 fingers, go to the chest, same part, where we showed in the adults, lower third of the chest, and keep pressing. If it's 2 of you, 1 person can encircle the baby, give compressions with the thumb. The other person can give breaths. And in a baby, like I said, especially a baby, when I mean a baby, an infant, okay, less than 1 year, they don't have many cardiac issues. There are children with cardiac issues, cardiac problems, but majority of the time, when a baby collapses, it is because of hypoxia. That is because of no or low oxygen. They need breaths more than anything else. We still give compression, and the compression will give them oxygen anyway. But let's say your baby has pulse, but the baby does not respond. You're trying to awake the baby, but there is no response. What you need to give is 5 rescue breaths. How you give breaths to a baby, Dr. Vikas will show you soon. But you can see in the picture that a baby, you cannot give only breaths to the mouth. You have to cover the mouth and the nose of the baby and give 5 rescue breaths. These 5 rescue breaths, you give 1 breath and see the chest rise. Okay. That way, if you give 5 breaths, you will see, the child might improve soon. And again, if the baby has a good pulse, you again turn the baby to the left side, just like how we did in the adult and the child, put in the recovery position till help arrives. One common sense, which I wanted all of you to remember, is that when you're alone, okay, and if the baby or the child or a man, someone collapses, call for help, okay? If you see someone collapse in front of you, then immediately call for help, then start the CPR. Then the other thing is, if you come into a room or come into a place and you don't know how long this patient has collapsed for or this person has been unconscious for, then you start CPR first and then call for help. First do CPR for 2 minutes, then call for help. Okay, this is common sense. You can understand. You don't know how long this person has been lying on the floor for. If you don't know, then start the CPR, then call for help. If you know that someone has collapsed in front of you, then call for help and then start CPR. Okay? Fine, let's go back to our demonstration now. Okay, just hold on, let me just pin you. Great, okay. Right, Vikas, so assuming that we have a child who's collapsed in front of us. This is a child, let's say a 10-year-old boy who's just collapsed, and luckily you're there. So you do the same approach again. Look for danger. Any danger, any fire, any electricity, any water, anything obvious, any chemicals. Okay, no danger. Then you approach the boy and check for response. Tap on the boy's shoulder.
Are you okay? What's your name,
Give a good squeeze to the shoulder. Yeah. So no response.
What's your name?
Okay. Call for help.
Nabil, can you help me call the ambulance or get an ED?
Okay. Call an ambulance, get an AED. Okay. So, and then you go A, B, C. Head tilt, chin lift. First open the airway. Head tilt, chin lift. Good. And check for pulse in the neck. Okay. He's feeling for pulse in the neck. Not more than 10 seconds. Fine. Any pulse, Vikas?
No pulse.
No pulse. Okay. So start CPR right away.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, 2 breaths. And if you can come closer and show where exactly we're doing the CPR, it's the same as we mentioned last time, the lower third of the chest. There's a chest bone there, and the lower end of the chest bone is where you're keeping your heel of the palm. Perfect. Yeah. And keep your shoulders straight, keep your elbows straight, do not bend your elbows, it has to be straight, and you give 30 compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
And if you notice the left hand of Dr. Vikas, he's keeping it on the forehead so that he can keep the boy's airway open. You understand? If you leave the neck bent, if you leave the neck to be bent, he won't have air going in. So you have to keep the head tilted a bit. Perfect. Okay, great. Thank you, Vikas.
Thank you. Thank you.
All right, so let's move to a baby now. So I hope we've saved the boy. Alhamdulillah, let's go to the baby now. So yeah, so baby is a bit more, what do you say? People are a bit more anxious when it comes to baby, and it's an emotional thing. But we have to, act quick in terms of a baby. Babies, every second without an oxygen is harmful for the baby. So when you notice that a baby has become unresponsive, okay, the same step process again, DRS ABCD. Look for danger, any obvious danger that we can look. Nothing around the baby, fine. Then approach the baby. Check for response. You can do in many ways. You can either tap the feet of the child, okay, of the baby. This is less than 1 year or less. We're talking about infants. And you can, so you can tap the feet. You can even shake from the shoulder, okay, a little bit, and check if the baby is making any noises, any response. Nothing. The baby obviously won't speak anything. So you have to check for any sounds from the baby. If no sounds, then
No sound.
okay, then check for pulse. Okay. So pulse is going to be on the keep your 2 fingers on the inner side of the arm, just below the shoulder, between the shoulder and the elbow. Yeah, so you press hard, you will be able to feel a pulse then. Okay, no pulse. Also, the same time, when it comes to the head of the baby, babies have big heads. Okay, so the head is big. You do not have to do head to chin lift. All you need to do is the baby's head has to be in a neutral position. Okay, and sometimes if you need to keep a support, you can keep something below the shoulders, like a small piece of cloth or something, just to keep the head in a neutral position. The baby's head need not be tilted like an adult. Okay, they just need to be neutral position. You can keep a small cloth just to keep, a little bit will be fine, just to keep it neutral. Perfect. Yeah. So once you don't feel any pulse,
No pulse.
right? No pulse. Start CPR right away. So 2 fingers.
2, 3, 4, 5, 6, 7, 8.
Right. Just between the nipples. Adults, child, baby, all of them, it's between the nipples. Okay. The center point. Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And when you give the breaths here, Dr. Vikas is going to keep his mouth over the nose and the mouth of the baby.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 20, 20, 20, 21, 26, 27, 28, 29, 30.
Perfect. Also, I would just like to add one more thing here. Like you mentioned, some of the babies do have pulse. Okay, many times they might have pulse, but they might be not responding properly. They'll be unconscious. They'll be looking blue in color because of low oxygen. It's called cyanosis. So in that scenario, if the baby has pulse but not breathing, you have to give 5 rescue breaths. Okay, and it's the same thing what Dr. Vikas did now, the same procedure. Just first thing, go directly give 5 rescue breaths. And how we give 5 rescue breaths? The same thing. Go cover the nose and the mouth. Okay, yeah, that's that exact place. Yeah, cover the whole of nose and mouth. Give good breaths, and you look at the chest. If there's it has to be lasting approximately 1 second. 1 breath, chest rise and up and down. 1 breath, chest up, down. 1 breath, chest goes up, down. So you are breathing for the baby. Give 5 rescue breaths. Okay, and that should be okay. Also, there's one more thing I wanted to add. If the baby has any obvious particles on the mouth, anything that is obstructing, then we can always remove it. If you can see it, that is causing. About details about choking, anyway, Dr. Zishan is going to talk about it. But if you see any obvious particles in the mouth, first remove that, and then give the rescue breaths. Perfect. Alhamdulillah, that's really nice. Thank you very much, Dr. Vikas. We'll come back to you soon.
Thank you.
Great. So moving on, I will hand now to my friend and colleague, Dr. Zishan Ghani. He's going to be talking about saving a choking person. This is something important to learn, and I will join you all again soon. Dr. Zishan, you can take over.
Hello, can you hear me, Nabil?
Yes, I can hear you. Yeah.
Okay. Yeah, Bismillah Rahman Rahim. Assalamu alaikum, everyone. So that was a very good presentation by Nabil and demonstration by Dr. Vikas and another Dr. Nabil who's with him. So next topic is saving a choking person. Now, when you see this, this is obviously a very scary looking thing. Choking definition is this happens when breathing is impeded by a constriction or obstructed throat or windpipe. Okay, this can happen in everyone, young children, adults, everyone. I'll just show a quick video if you can see this clearly. I won't show the complete video, it's there in the link. Now you can see the woman here, how she's panicking after she's seeing her baby choking. This can happen to everyone, to any one of us. This is just to show how scary the situation can be to a mother. And you can see the woman is she's trying to do something, but she doesn't really know what to do. And people come and they don't really know what to do. They just keep hitting the back and they just keep trying something, hoping for the best. But you can see how this mother is panicking and crying. I'll stop the video here. Anyway, the child does survive. You can see it completely later on. Coming to normal anatomy, normally when a person eats, what you see is, this is where the food that they eat, the green food that they eat, it goes into your food pipe here at the back, and eventually they swallow it up. Okay, but when you breathe, it goes in through your nose or your mouth, and this is your windpipe, and this is where it has to go. Your air has to go here, your food has to go here. But for a choking person, what happens is, whether it's a food particle, a toy, anything, instead of it entering the food pipe here, it gets stuck here in the windpipe here. And now they can't breathe. And if they can't breathe, they will suffocate and they will die eventually. That's very dangerous. That's why we need to do something to bring this out. Now, how do you recognize choking? First of all, this will happen very sudden, all of a sudden, without any warning. You will not know what the person was doing. Suddenly you'll see them, they're coughing and, they're saying something, or a person next to them might have witnessed it. They'll say, okay, I can see them, they ate something and they coughed and they choked. And if it's a child, you may see that the child was playing with some toys in their mouth and then they suddenly start choking. Okay, coming to the next slide. This man, Dr. Henry Judah Heimlich, he is the one who discovered this procedure that helps us to treat them, to see what happens. Okay. I don't know, there's something coming on my screen. Nabil, do you have control of the monitor? Anything? No. Okay, so coming to choking in adults. What does choking look like in adult people? You will see them holding their neck. They will not be able to cough or breathe. Some of them might be able to partially cough, but the universal sign of choking is you will see them holding their neck and saying that I can't breathe. Okay. If you are alone in a situation like this, what you can do is you can help yourself. You can place a fist on your above your umbilical or above your belly, and you can press yourself hard on a sofa, so that puts pressure on your tummy, and that makes it the foreign body to come out. Okay. But ideally, if there are two people, what will you do? Well, the first thing is come behind the person. Okay. Make a fist with your hand, and then with the other hand, put pressure on that fist and start pressing upwards. And when you start putting this pressure upwards, there will be some pressure generated in the tummy that will make the food particle to come out. Okay. Let's go to the next slide. Okay. Now, let me show this to you. Now, this is this man who's choking here, and this other person comes from behind and starts to do this Heimlich maneuver. Okay. So this is when he goes behind him and he starts choking him. You can see that. You can see because this is a large man, he is putting a lot of pressure. Okay. And finally, whatever the food particle is, it eventually comes out. All right. Yeah. Similarly, in this video as well, this man is here eating food, and this person comes behind him and begins to help him and starts doing the Heimlich maneuver again. Okay. That causes the foreign body to come out. You can see it in this video as well. This man, he's suffering for up to 1 minute before someone actually comes and helps him. And this is a common problem among people. They don't tend to help even though when a person is suffering. This man goes up to 1 minute walking around and no one comes to help him. Eventually someone comes and helps him towards the end. Then the foreign body comes out. Okay. But this is what we need to remember as well. Okay. Now we will be demonstrating that how it needs to be done on an adult and a child as well. But you get the principle. Now the next thing, which is the most scary thing for all of us, choking in children. Okay. You know, children are naughty. They tend to go around, explore things, try and eat things which they shouldn't be eating. And a lot of times those objects are much bigger than they can swallow. Okay. If it's a child older than 1 year, if it's an elderly child, you will do the same procedure as what you did on an adult. Go behind the child and start pushing on the child's tummy just above the belly and start giving pressure. And when you put the pressure, they will be able to eventually cough it out. Okay. If it's a young baby, if it's a child less than 1 year old, the first thing what you would do is turn the child around, okay, and look into the child's mouth and try to bring out the foreign body, bring out the object, okay. And remember, do this only if you can see it. If you can't see it, please don't do it. There was a case of a woman in Kerala. She tried to remove the foreign body out of a child's mouth. She tried so much, but the child eventually suffocated and died. But she did not know what to do. That's the only thing she could think of. Okay. So take out the object only if you can see it. Hold the child on one of your hands, left or right side. Whichever hand is stronger, put the child on the other hand and do 5 back slaps on the child's back. This helps in the child spitting out the object. Once you're done with this, turn the child around. And then, yes, this looks very odd. This looks a bit scary, but this is how you can apply pressure. Now here you will put pressure on the child's chest here, on the bone. Normally you put it on the abdomen, so you can apply pressure on the tummy. But here you'll apply pressure on the child's bone because the abdomen is sensitive. So the bone is better. So when you do that, this will help in them spitting it out. So to, remember 5 back slaps, 5 chest thrusts, 5 back slap, 5 chest thrusts. You need to keep doing this, and you will check after chest thrust into the mouth if the object has come out or not. Okay. Now, in this video, you will see there's an animation that will be helpful. Now, when you start giving the 5 back slaps, what happens is there is pressure being generated in the back, and that causes pressure in the lungs that makes the object to come out. As you can see here, eventually it comes out. Similarly, when you turn the child around forward and you do the same thing, you start putting pressure here on the chest. Again, that generates pressure inside the small lungs, and that makes the object to come out. Okay, as you can see in this animation. Yeah, because it's a small lung, and you need to keep enough pressure for it to come out. Yep, that's what happens. And if nothing works out, you need to call the ambulance. You need to call people for help. This is another video. This woman helping this child. You can see the child is trying to cough and cry, and this woman comes from behind and does the Heimlich maneuver, and eventually you can see it comes out. The child is feeling better. This is another quick video because we're running out of time. All these videos will be in the slide. You can see them later. But you can see how they're doing this and to save the child here. The child ate something which he should not have. Yes, it's a very panicky situation. The child did survive in the end eventually. So they keep doing this to make the child spit out the foreign body. Okay. In summary, for children, remember, if you see them trying to cough and they're crying, tell them to cough out more. See if the things come out. If they're not coughing, give them 5 back blows, 5 chest thrusts in young kids. If they're older kids, do the Heimlich maneuver, come from behind and do the pressure on the abdomen so it comes out. If they become unconscious, if they don't breathe, you will go according to what Nabil has been teaching so far. Check the pulse, start doing CPR, give 5 breaths, call for help. Okay. Yeah, now we'll have a demonstration with our friend Dr. Vikas. I'll give on the video to him. Yeah. Yes, Vikas, you can go ahead. Yeah.
Okay. Assalamu alaikum, patient.
Awesome.
So,
Yeah, so you can demonstrate with the adult first. We'll have a volunteer. Our friend Dr. Nabil has been very helpful in demonstrating. This is another Dr. Nabil, who's been very helpful with the camera works as well. So can you come a bit more closer to Vikas, Nabil? So a person, when he's choking, he would hold on to his airway and he say, I can't breathe. I can't breathe. There's something stuck. He would try to talk. Then you as a helper will go and approach him and ask him, are you feeling okay? Can you cough, or cough anything out?
Can you cough? Can
No.
you cough?
He says no. Then you need to go behind him and attempt the Heimlich maneuver. So he'll make a fist, hold just above his belly, and then with the other hand, he will start giving pressure. Yeah, exactly. And you can see, and then eventually when it comes out, the person will start feeling better.
okay.
The other thing is, as what Dr. Vikas has done is, he held his foot below the other person's foot, between his feet, so that to avoid him from falling forward or falling backwards. You can see his foot. So this is to balance him, because even you shouldn't be falling if this is happening. Or can you show the whole same thing sideways, because the Heimlich maneuver, yeah. Sideways, yeah, show in this angle. Yeah.
Yeah.
So again, 1, 2, you keep giving pressure, exactly. Yeah. Then until it comes out. Yeah, okay, thank you. Now,
Thank you.
the same thing on the mannequin, because to know where you need to keep your hand exactly. Okay. So Dr. Nabil is taking the camera again. Now, okay, if you can come closer to the person's body, then we'll see. Now, can you show where the muscle is, the diaphragm muscle is?
Yeah.
Yeah, so that's where the muscle is. Yeah. Now, when you're doing CPR, you're putting your compression on the bone. Yes, that's where the bone is, because you want to press the heart. You don't want to press anything else. But when you're doing the Heimlich's maneuver, you're going below this. You're pressing the muscle. And when you press onto the muscle, that creates pressure inside the diaphragm, inside the lungs. That pushes the object out. Can you show the procedure on this? Because, yeah.
Yes, yes. So this is umbilicus. This is the belly point, and
Yeah.
this is the end of that bone, and this is where diaphragm starts. Okay, just above the belly bone, but below the end of the sternum, that is the ZV sternum. So this is a place. So you need to hold your fist like this, push up, push up, push up, and then
Exactly. Yes. This procedure looks pretty exhausting, but it is exhausting because you need the you need the foreign body to come out. Okay. So we imagine when it's a live, actual human being, the amount of pressure you need to put, because you're saving his life. If you don't do it in the next few minutes, he might die. Now, the next thing we'll see is the baby. All right. Now, if a baby was eating something and then you see the baby is not able to breathe, you'll go near the baby and see if the baby is okay. So try and, approach the baby, see if the baby is all right. Talk to the baby, see if they can breathe or anything at all, if they can cough. No, they can't. Then look into the mouth.
Hello.
See,
Hello.
see if there's any foreign body inside their mouth, any objects in their mouth. If you think there is something, then you need to move ahead for the back thrust. Okay. Now let's say nothing comes out and now you're scared. The baby is not breathing. Baby is going pale, blue. Then now you need to start giving back thrust first. Okay. So you will sit down and then you'll hold the baby in your hands. We'll just see how to support the baby. Okay. So with your fingers, hold the baby's face, support the baby, and put the baby on your elbow. Remember, this is for a baby less than 1 year. A larger baby, you'll be doing the thrust, abdomen thrust. So now this baby, you'll tilt the baby forward, put the baby on your knee, all right? And now start giving back thrust, okay? 5 back thrust. 1, 2, 3, 4, 5, okay? Now you're giving the thrust on the upper half of the back, not the lower half, because that's where the lungs are, all right? Yes, it looks very violent, but then you need to create enough pressure inside to spit it out. So the baby can spit out a foreign body. The next thing is you'll turn the baby around, put the baby on your other knee. We've lost your video, Vikas. Can you hear me, Dr. Vikas?
Just give a moment
Hello?
for him to come back. We'll just give a moment.
So until he comes back, I'll just tell you what we should do. You should be putting the baby on your other knee and start giving abdomen thrust again. Or not abdomen, sorry, on the chest. You'll start giving pressure on the chest with your hands or finger, so that enough pressure can be generated inside, so the baby can spit out the foreign body. Okay. Until Dr. Vikas comes back, I think we have lost him.
You can go back to the slides probably.
Yeah,
till he
I'll go
comes
back to the slide till he comes back. All right. Now, where were we? Yes. Oh, here. So when he comes back, we'll see. If he doesn't come back, then I'll stop with the slides and we'll move on to the question and answer sessions. Okay. So look what this person is doing here. They're giving them enough pressure on the chest. Okay. Now this is a very helpful video. I'll show it again. Now, once they've turned the baby around, they put the hand on the baby's head. All right. And then they slowly turn the baby the other way, like this. And again, you put the baby downwards, okay? And with your 2 fingers, start putting pressure on the chest. And remember, it should go in an upward direction. It shouldn't go downward. It should go upwards towards the child's airway, the mouth. And when you keep doing this, you should be, hopefully you should be noticing something that's coming out. If nothing is coming out, keep trying it again. Okay. Keep trying the same thing. Go back to 5 back thrust, go back to 5 chest thrust, go back to 5 back thrust. Keep doing this till you see something. All right. If nothing happens, if the child has collapsed, unfortunately, that's a very bad sign. But then you need to start saving the child again. You need to go back to the beginning, the BLS. Now the child is unconscious, no response. Check for pulse, no pulse. Start giving chest compression and rescue breaths. Call for help. Okay. Is Dr. Vikas back?
Yeah, I think he's come back. You can ask him to join.
Yeah. Okay. Yes, you can go ahead. So the back thrust, after the back thrust was done, we'll turn the child around. Just show where you kept your hand behind the head. Yes. So you're supporting the neck because you don't want the head to go floppy yet. So you're supporting the head. Okay. And then you give 5 chest thrusts again. 1, 2, 3, 4, 5. It's slightly upward direction also. Yeah. Okay. 1, 2, 3, 4, 5. Then look something in the mouth. Is there anything in the mouth? Because any object, any coin or anything like that? No. Then you start giving back thrust again. Okay. Yeah. Yeah. And look if there's anything. 5 chest thrust and look for a foreign body. Hopefully this should be enough for most kids. The foreign body should be able to come out. If it doesn't come out, remember, you need to go back to your basics again. Pulse, chest compression, rescue breath. Yeah, that's what. So thank you, Dr. Vikas. Thanks, Dr. Nabil, for your demonstration. You people need to practice this. Of course, don't practice on a live person. It can be very dangerous. But then on a pillow or something, hard pillow or a doll or something, at least know your theory. So at least when you're faced in a situation, you can do something in real life. You shouldn't be lost. Okay. We'll move on to question answer session now. Unfortunately, our friend Dr. Nuruddin was not able to join us because he's been caught up in the hospital. He's got a very busy day today. So because he's not able to join us, we'll be doing the question answer session ourselves. Okay.
Jazakallah khair. Thank you, Dr. Zishan. I've noticed that people have not really posted a lot of questions so far, but I think this will be the right time for them to post their questions. I've noted down a few questions for your talk.
Okay, that's fine. Yeah.
I can ask you those questions. Meanwhile, I'll keep an eye out for any other questions which are coming.
Yeah, that's fine. Okay.
All right. So the first question was, just asked, the back thrust, does it have to be hard or normal?
It has to be hard.
Yeah.
It has to be hard enough to generate pressure inside. It's called, it's even called back slap for a reason. You're actually slapping the back.
Okay. Yeah. What shall we keep Vikas's video on so that if any answer that needs to be demonstrated, we can do that at the same time?
Yeah, that's a good idea.
Yeah. Vikas, can you come in? Okay. While she's coming and joining us at this point, we will move to the next question. If the baby stops breathing when crying, what to do?
You mean, okay, so they haven't
get. Yeah, I know
Okay.
it's not really clear at
Okay.
this point of how
Okay,
if we
so I
can run
think
through few things. Yeah.
I think what they're asking is some kids they cry, and then they stop breathing. That's called a breath holding spell. So children do that because they're breathing in and they're crying out again. That's not choking exactly. That will only last for a few seconds and then they will start breathing again. This is only when you think of there being something inside the airway, something getting stuck. That's when you do this. Otherwise, you wouldn't do this. If the child is just crying and then stopping to breathe, they will go back again.
Yeah. And the other question was about COVID. What I wanted to tell about COVID was that the reason we didn't really mention much about COVID is that babies having COVID, the incidence is really very, very low. That's the reason it's very, very low compared to adults. And if so, there is a child, if a baby who has a COVID, and we would tell the same precautions like an adult to put a cloth on the face of the baby and give breaths. Okay, and that could be life-saving for the baby at that point. If you don't have to give rescue breaths. If you want, you can only give the compression in the chest. That should be enough. Okay.
There is a question for you, Nabil.
Yeah.
So, while doing CPR for a child above 1 year old, 2 breaths are enough, or breathing should be given for 2 minutes?
No, we don't give breathing for 2 minutes. For 2 minutes, what you're going to do is 30 compressions, 2 breaths. After 30 compressions, 2 breaths. That's only if you're there. If 2 people are there, then it's 15 compressions, 2 breaths. 15 compressions, 2 breaths. You give breaths continuously. When I mean continuously, is when when the child does have a pulse. They have a pulse, but they're not breathing. Then that's when you give breaths, continuous breaths. For around 2 minutes, or maybe you can give like 6 breaths and you can check the baby again. Yeah.
And the next thing is, what is the normal pulse rate for a baby and a grown-up person?
So a baby, again, the baby's pulse rate and blood pressure, all of this changes with age. So average is somewhere between 110 to 160. It can vary between anything above 100 should be normal for the baby. 110 is normal, okay, for an infant, okay. So it can go all the way up to 160 beats per minute. But for an adult, it is between 70, let's say between 60 to 90, the range is there. Okay, 72 is what they say is normal, but the range is between 60 to 90 is normal for an adult. Above 100 is normal for a baby. Yeah.
Okay.
And
Can we give
yeah,
chest compression to a COVID patient if they are choking? That's an interesting question.
chest compressions to a COVID patient who's choking. So choking, I think I think you can answer the choking part. Choking part is not going to change much, I think, isn't it, for a COVID person?
Exactly. So, yeah, because you're going behind the person and then you're pressing on the abdomen. So whatever is coming out of the mouth is going in the front, and you're standing behind the patient. So that's not really a problem. Somebody asked,
Okay.
it looks very painful. Yes, it is painful, but you need to save the person's life. That's why you're doing this.
Yeah. Someone's asked, what's the most evident sign of a baby choking?
Most evident sign of it. Yes,
baby choking.
the baby will go pale, blue, not breathing properly, eyes looking odd, mouth frothing coming out. That's the obvious sign. Every person will have a different sign of choking, but this is what it is for a baby. You will be able to see that. Okay, and again, it depends. Is it a baby that's just sitting there? Okay, that's different. The baby wouldn't really go and eat something. But if it's a baby that crawls and eats things, then you need to see the sensation that someone has while choking. I think all parents have seen the kid when they eat a large object and they're trying to swallow, how their face becomes. That's what it is. You give back slaps when that doesn't happen. Same thing with milk. If they drink milk and they're choking, give them some nice back slaps. Let that come out. Okay.
Okay.
I think Vikas has come back on now.
Yeah, can I ask Vikas one thing? Is Vikas back on?
He's on.
Yeah,
He's on.
can you put him on the spotlight? Yeah,
You need to stop sharing.
I can stop the sharing. Yeah.
Okay,
Great.
yeah, he's back.
So because I think there is a direct question to demonstrate something. That someone was asked to demonstrate a self-rescue during choking, like we mentioned about it. Do we have a chair or something because that we can, or the table edge, we can show how to. You can use a table. Yeah, that's fine.
Can you hear me?
Yeah, yeah.
Okay, great. Okay. So I can use this table edge. Should be little
A bit more
higher.
taller.
Yeah.
Yeah, correct.
Yeah. So what I can do is, you can either go down, kneel down, okay, kneel down myself, and push, push, push. Yeah. There's a pressure I can do. Probably the edge should be a little smoother. That'll be better.
Perfect. Yeah. Perfect. Thank you very much. Because I think you can stay on the video if you want.
Yeah, stay on the video.
Yeah.
And I wanted to mention about this that, like Dr. Zishan's already mentioned, we continue to give this and do this maneuver of, Heimlich's to relieve a choking person. How long are we going to do this? We're going to do this until the food particle comes out.
Comes out. Yeah.
Okay. Or
Yes, until it comes out.
or the pace or the person collapses. Because there are some questions on that. So I'm saying that we're going to do this until the particle comes out or the person collapses. If the person collapses, you start with your DRS ABCD, start your normal, procedure of checking for pulse and other things.
So, yes, you have only two options. Either the foreign body will come out, or because the person cannot breathe, he will collapse. So if he collapses, you go to whatever from beginning, check pulse, look for any breathing signs, and start chest compression. That's if they collapse, and if they don't collapse, keep doing the chest thrust and back slap till the foreign body comes out.
Yeah.
Either of these two things will happen. There's not, yeah. The other thing is, so now what happens if the foreign body comes out? Yes, then you need to ask the person to spit it out. Okay, spit out the thing, give it out and throw it away. That's whatever you do. Some people they swallow that for, yeah, keep in the recovered position. Very good. Some people they just swallow that whatever food particle it was and they feel better. So I think someone had asked if the person feels normal after choking, but I can still feel the presence of food particle. Yeah, if you feel normal, then the food is gone inside. If you want the irritation you feel in your throat is because of that obstruction. That thing has damaged the skin nearby. That's why you feel that irritation that something is there. But once it's gone, it's gone. Hopefully it won't come out again.
Okay, there are a few other questions I've been trying to.
Can I add, Nabi?
Yeah, go on. Yeah.
Yeah. So if a patient is able to cough out, and if he feels still there is something left in his throat, it's better you can ask him to cough. Cough makes more, brings out more pressure. That any residual like bits of other meat or something which is left behind, it might come out. So until it is that, if you can't able to cough, then that's a big problem. If you're able to cough, that will be a good solution.
Yeah, I mean, it's a common practice in many places. We see that someone is coughing and they ask the person to stop coughing or they tap on his head and things like that. But cough is a natural mechanism. Again, if someone is coughing, you should encourage them to cough so that they feel better. Okay.
So there's a question for you, Nabil.
Yeah.
How long should you give a rescue breath for?
For a baby?
No, for anyone, rescue breath.
Yeah.
Deep inhale, exhale. How do you do it?
Okay. So ideally, one breath okay, for 1 to 2 seconds. And instead of giving you a number, what I'm going to tell is when you give a breath, see if the chest is rising and then goes back. Okay, normal. Like how you're breathing in and out. When your chest moves up and down, every breath you give should have a chest rise and goes down. Chest rise, goes down. So keep giving this breath, okay, until you see a change in patient's response. Okay, they're not responding probably because of low oxygen. So when you breathe out, we all know that we breathe in oxygen, but when we breathe out also there is oxygen in it. I know it's more of carbon dioxide, but there is oxygen in the air that we breathe out as well. And that is the whole reason that we give a deep breath, blow air into the person so that the person gets some oxygen, it opens up his lungs. Breath.
And the other thing, yeah, sorry.
Yeah. Go on, yeah.
No, the other question was a very broad question. Why do people become unconscious in these situations?
So as we mentioned, the whole, inshallah, I'll be showing more details of the science behind this next class. I didn't really include all of that this class because it might take a lot of time. I wanted people to learn these basic things first. The science behind this we'll explain next class, inshallah. The whole purpose of giving chest compression is to give blood to the brain. If your brain is getting blood flow, okay, it keeps you awake and keeps you, conscious. If the brain stops having blood, then it becomes unconscious. Or your blood pressure falls, you become unconscious. You faint, correct? So the purpose of giving chest compression is to make the beat, press the heart so that the heart pumps blood to the brain. Okay? Yep. And people become unconscious of various reasons. So we will go into details next class, inshallah.
There's another interesting question. Maybe you can answer this one. So what if the patient is epileptic? He has a seizure and chokes at the time.
Yeah. And seizure, again, I was planning to cover in the next class. So if a person is seizing and if he's choking on something, you put him on the recovery position first. Like how Vikas showed, tilt him to the left side so that any saliva or any fluid or anything or blood that is in the mouth will start coming out. And we do this in the hospital as well. Whenever a patient seizes, when he goes into has a seizure, we turn him to the left side so that he doesn't hurt himself and also that his mouth is clear of fluid. There is no evidence of giving anything to the person having a fit. Like you would have seen some people give some keys or something in the hand and all that. All that doesn't work. Okay. Yeah.
We have 10 more minutes, so we'll just.
Yeah, I noticed few questions for you as well, I think.
Okay.
Someone was asking on, I think you've already spoken about breath holding spells in children. It's a very common question that's coming up again and again. They have to differentiate between breath holding spells and choking. Can you explain that one more time to them?
The breath holding spells.
Yeah.
Oh,
the baby, we can't really do anything. Yeah.
So kids, they cry a lot. Same thing. When you run a lot, you get breathless. You need to take rest, and then you start breathing again. So kids, they're putting so much pressure, and they start choking. That's not actually choking. They're just coughing out because they're getting breathless. You just need to calm them down, and they'll start breathing again. Why will you do backslap on a child who's just crying and not breathing? Nothing's going to come out. They'll just calm them down, reassure them, and they'll be fine. If they're choking, just calm them down. The other thing is, people will be like, what? So once they're calm, what do we do then? No, once they calm down, you just take care of them. Don't give them water immediately. I think a lot of people are asking that, if somebody's choking, do we give them water? No, I don't think so. You're making it worse. Because if somebody's choking, then there's not enough air going into his windpipe. It's getting blocked. Why do you want to put water in it? Your water will go and make it worse. Never, never. Unless a person sits up, talks to you normally, says, I'm feeling fine, I'm okay now, can I have some water? Then you give them water. Somebody is on the floor choking and he's saying, I can't breathe. Don't give them water. You will make it worse. It's very dangerous if you do that. Yeah. Okay. The other thing someone had asked, what about adults? Do you give them back slap on for adults as well? You can give it, but the Heimlich's maneuver is the best thing for adults because nothing creates more pressure in the lungs than Heimlich's maneuver. It's much better than back slap. For children, yes, back slap. For babies, for adults, just go for Heimlich's maneuver.
I think like if the adult is so large, sometimes they're so obese that you cannot reach your hands. In that scenario, if you're not able to do Heimlichs, then you might as well do a back pat in the back. Okay, worst case scenario. But if you can do it, it's always best to do Heimlichs. Yeah.
So one question, Nabil. So let's say somebody has collapsed and you're doing CPR,
Yeah.
and you know that they had choked and they collapsed. So
Yeah.
now what will you do? And if you see that foreign body in the mouth, what will you do?
Yeah, I think we'll do the same thing. DRS, ABCD. Okay, we check for response, no response. Then we go with airway. When you tilt the airway, if you see something obvious in the mouth, first remove that. And then check for pulse. Yeah.
So let's say Vikas is giving CPR now. Okay. So this person had swallowed some foreign body and you're giving CPR.
Yeah.
So when you do your 30 compressions, if you are giving rescue breaths, or if you're just giving it continuously 100 chest compressions, then you will take a break, and if you see something coming out, you will take it out quickly. If you can just show Vikas, if you found something, example. Can you hear us? I don't know if you can hear us.
Small lag in the video, I think.
Yeah, because so yeah, whenever you want to stop, you can stop and just see how you take out a foreign body from the mouth. Okay, there's an interesting question for you.
Can I answer 2 questions related to CPR they've asked? I just made a note of it.
Yeah.
So one was how long to check the pulse for. Okay, check the pulse for 10 seconds. And someone's asked how many pulses to check within 10 seconds. There is no fixed number for adults to check pulse. All you need to feel is don't keep trying to feel for a pulse more than 10 seconds. If you go on feeling, some people are positioning their hand, they're trying to press different parts of the neck. You will delay CPR because of that, and that is more harmful. So the best thing is to keep for 10 seconds, stop, close your eyes, try to concentrate and see if you can feel for 10 seconds any pulse. If you feel even 1 or 2 pulses, no problem. That's fine, that he still has pulse, okay, or a weak pulse. If he doesn't have any pulse at all, continue CPR, no problem. And someone has asked, what's the harm of doing a CPR? The maximum that can happen, that what we have done CPR on probably hundreds of patients now, and we see sometimes that the harm that can happen is maybe few ribs can be cracked while doing a CPR on an adult. That is not going to kill somebody's life because a few ribs broken. What is going to kill them is not having their heart beating. What is going to kill them is not having oxygen going to the brain. Okay, so the ribs breaking, no problem, don't worry. And in children, when you do CPR, the ribs don't break because ribs are very soft in children. Okay, they're very pliable, so they don't usually break. So don't worry about doing those maneuvers in the children.
Okay, I'll ask you a difficult question, Nabil. So what if a pregnant lady chokes, or a mother who's had a recent cesarean procedure, if she chokes? Related to that is, what if this is a very old woman who chokes?
Okay, you're asking if the pregnant lady chokes and an old person chokes.
Yes, and also a woman who has had recent surgery.
Yeah, the principles apply the same. Okay, for a woman, let's say, who's pregnant, and pregnant in the sense they depends on which trimester they are on, first, second, or third trimester, how big their belly is. The same principle applies. If the mother is not able to breathe, the mother's oxygen level in the blood will go low. If the mother's oxygen level goes low in the blood, the baby will get less oxygen. So I know it might look scary, but you still have to do the same maneuver for the pregnant lady when she's choking to relieve her of a choking so that she gets a breath. Okay, with same position as high as you can go. Okay, above the belly button, and then do the same maneuver. For the old person, it's the same. I don't see any different thing. For an old person, it's the same procedure.
Okay, so now there's a question that people are asking.
We have 5 more minutes. We'll stop and we'll take for another 2 more minutes, inshallah, and then we'll stop.
Yeah. Yep. So I think the people's most favorite question is, when you are doing chest compressions or when you're giving abdominal thrust, Heimlich's maneuver, you're breaking bones. Is that a good thing or a bad thing? Why are we doing it so violently is people's question. What if we break bones? What are the things that we can damage? I think we can just show it on the mannequin? You can answer that maybe.
I think I just spoke about it. Like I was
Okay.
reading that, that where you might crack ribs. That's all that happens when you do it. Not during Heimlich. Heimlich, I don't think you'll do much of a damage. Heimlich is relatively a safer procedure where you're pressing on the soft part of the abdomen. You're pressing on the soft part, the diaphragm. You're not directly pressing on the bone like CPR. So Heimlich, I don't think you'll cause much of a problem. It is only during CPR when you're pressing on the bone that you might end up cracking few ribs. And that is not a problem at all. Don't worry about what breaks, on your ribs. Ribs, when they're broken, they join back when they heal eventually. Okay, so don't worry about it. The harm, in short, I want to say there is no major harm of doing CPR on a person who's collapsed. He's already dead. In the sense, let's not say dead, let's say dying. Okay, in a dying person, what more worse can you do? Okay, at this point that you're doing a life-saving procedure, and this should help him. All the remaining small damages which happen is fine. Okay, that can be fixed later on.
How many pulses is a weak pulse?
Okay. For an adult, like we said, for a baby, I'm only telling that about a baby and a child. If it is less than 60 for a child or a baby, then you do CPR. For an adult, even if they have 40, 30, 20, that's fine. You still have a pulse, that's okay. The heart is still beating. You have to wait till ambulance arrives. You can give rescue breaths till then. You don't have to do CPR.
This is one question I'll ask. I'll answer. What if there's a okay, before that, Nabil, so when you said weak pulse, I think what people should know is in 10 seconds, if you get 6 heartbeats, that means that's 60 per minute. If you get less than 6 in 10 seconds, that means it's very low. Then you may do CPR on a child or a baby. There's one question that I got. What if there's a fishbone in the throat? I think if there's a fishbone in the throat, it will cause irritation. It will not cause choking. I mean, how big is a fishbone? It's very small. So if that happens, you need to go to the hospital to ENT where they can remove the fishbone. They'll have some spray which will numb your back of your throat, and with some forceps they'll take out the fishbone. I mean, I've seen that a couple of times done. We've done it for a few patients. It's not that difficult, but it can be done. But you can't do much on your own if there's a fishbone stuck. You need to go to an ENT doctor. If somebody's saying if you break ribs, what happens? Yes, I think people need to get into their mind. Ribs can break, but ribs will also heal like any other bone in the body. All right. Breaking ribs is better than the person dying. The ribs will break for some time. They'll have the pain when they wake up, but they will be alive. All right. Don't think it's so scary. Ribs break. We all felt ribs break when we're doing CPR, but they heal back. But the good thing is the person is alive. When you see a person alive after you do CPR, that is much more rewarding experience than everything else that happened. Ribs breaking, this and that. That is a very rewarding experience when you see it in front of you.
Okay. Alhamdulillah, I think from now on, we will continue taking the questions in Google Classroom. Okay, the Google Classroom is open. Please, those who have not signed up for it, okay, please join the Google Classroom and ask your questions there. We are very, very happy to answer your questions in the Google Classroom. We see it really inactive. I was thinking about it, then I was expecting more questions in the Google Classroom. So please ask your questions in Google Classroom. We can answer. Because of time, we have another class starting in 15 minutes, inshallah. I would like to summarize now. Let me go back to my slides. So our next class, inshallah, will be on October 11. So we will continue this. That will be our final class on BLS. So we have 3 classes in BLS. The last class will be on October 11th, inshallah. And we will talk about the chain of survival and AED. So AED is a hot topic that we need to discuss. We'll talk about shock and collapse, with pulse, what to do. We'll talk about severe allergy or anaphylaxis. And we'll talk about a mobile app which has saved and is saving many lives at the moment. And what is it that we can do? Some of you are in the coding class. It'll be an interesting topic to discuss about it, inshallah. The last thing I wanted to say was, guys, go and practice. All the women, sisters, and brothers, I would encourage that go and practice on a pillow if you want, not on any live person, not on your friend, not on your parents, not on your sisters or wives. Please don't try it on anybody. Okay, live. Try these procedures on a pillow if you want. And I will encourage you that you should practice so that you get an idea what to do when it really happens. Okay. Jazakallah khaira for attending today's class. And barakallah feek, everybody, for joining us today. We would see you again soon, inshallah, on October 11. I would like to remind that in the next 15 minutes, less than 15 minutes, we'll have our class on countering the attacks on Islamophobes, dear brother Nuru Duha Barmawa. So please stay tuned. If you want, take a quick break, pray your salah, get a quick refreshment, and join us back in 15 minutes, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Subhanakallah wa bihamdika. Ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk.
Wa alaikum assalam.